Did you know cancer is the second leading cause of death worldwide? In the United States alone, about 1.8 million new cancer cases are diagnosed each year. That's a scary fact, but there's good news. The sooner you detect and treat cancer, the better your chances of beating it. Early detection is a powerful weapon against this deadly disease. Everyone knows someone affected by cancer. It's a devastating disease. That's why it's crucial to recognize the early warning signs. We've put together a list of 8 symptoms you should never ignore. Knowing these signs could potentially save your life. Cancer is not just a random killer. It's often fueled by our daily choices. In the United States, about 42% of cancer cases are linked to preventable risk factors. Think about that for a moment. Nearly half of all cancer cases could be avoided. Smoking, being overweight, drinking alcohol, and not being active enough are like ticking time bombs inside your body. Did you know that eating too few fruits and veggies or too much processed meat can also increase your risk? Even the air we breathe can sometimes be a threat. Imagine living your life thinking you're safe, but your everyday habits are secretly setting you up for a potential cancer diagnosis. Some risks you can't change, like your age or genes, but many you can. The scary part? 2 people living similar lives might not share the same fate. This is why knowing the symptoms is so crucial. Sign 1. Excessive weight loss. We all experience weight changes from time to time, whether it's due to diet, exercise, or different life stages. But what if you start losing weight quickly without trying? That's not just unusual, it's a big warning sign. Imagine stepping on the scale and seeing you've lost 10 pounds or more without changing your diet or exercise. This kind of sudden weight loss is not typical and could be a sign of cancer. Cancer consists of abnormal cells that grow uncontrollably. These cells hijack your body's energy supply, causing you to burn more calories even when you're at rest. Did you know that unexplained weight loss occurs in about 40% of cancer patients at the time of diagnosis? This is especially common with cancers of the pancreas, stomach, esophagus, and lungs. If you're shedding pounds without trying, it's time to see a doctor. Sign 2. Mysterious pain. Pain is your body's alarm system, and it will tell you when something isn't right. Think about how a toothache gets your attention and makes you rush to the dentist. But what if you have pain that sticks around without any clear reason? If you're not doing anything strenuous, yet there's this nagging pain that won't quit, it's time to see a doctor. Did you know that over 50% of cancer patients experience pain at some point? But why does this happen? A tumor is an abnormal growth of cells that forms a mass. Tumors can be benign, non-cancerous, or malignant, cancerous. Malignant tumors grow uncontrollably and can invade nearby tissues or spread to other parts of the body, metastasize. As a tumor grows, it can press on nerves, bones, and organs, causing pain and disrupting normal bodily functions. Imagine a growing mass inside your body pressing against your nerves or organs. This pressure can cause a constant, dull ache or sharp, intense pain, depending on the location and size of the tumor. Additionally, some tumors release chemicals that can cause inflammation and pain, adding to your discomfort. Tumors can also block blood vessels, cutting off blood supply to certain areas, which can result in pain and tissue damage. Sign 3. Difficulty swallowing and a nagging cough. We've all had moments when swallowing feels difficult, like when a big pill gets stuck or food goes down the wrong way. Usually it's nothing serious. But what if this starts happening more often, and you also have indigestion? These could be signs that something's not right with your esophagus. Could this be an early warning of esophageal cancer? And what about a persistent cough that just won't go away? It can be easy to dismiss as just a lingering cold, but if it doesn't get better, it might be something more serious. A nagging cough can be an early sign of lung cancer. Similarly, if your voice sounds hoarse for weeks, it's not just a sore throat. It could be a red flag. About 20% of lung cancer patients first notice a persistent cough or hoarseness. If you're experiencing these symptoms, it's important to see a doctor. Sign 4. Is there a lump? You're going through your daily routine, maybe just getting dressed, and suddenly you feel a lump that wasn't there before. What's your immediate reaction? It's natural to worry. Unusual lumps or swellings can be frightening. They might be harmless, like a benign cyst, or they could be a sign of something more serious, like cancer. Think about a time when you found a bump or a bruise and couldn't remember where it came from. That concern you felt is justified when it comes to unexplained lumps. Whether it's a lump in your breast, under your arm, or in your neck, these can be signals that something's wrong. For instance, a lump in the breast can be a sign of breast cancer. Lumps in the neck could be related to lymphoma or thyroid cancer. Did you know that about 90% of women who find a lump in their breast do not have cancer? However, this doesn't mean it's safe to ignore it. Getting it checked promptly with tests like mammograms or biopsies can help determine if a lump is cancerous. The sooner you know, the sooner you can take action. Don't wait. Your health is too important. Sign 5. Unexplainable fatigue. We all get tired from time to time. After a long day at work or taking care of the kids, it's normal to feel exhausted. But what if this tiredness doesn't go away, even after a good night's sleep? This kind of fatigue is different. It's extreme and unrelenting. Imagine feeling completely drained all the time, no matter how much rest you get. So, what's happening in the body to cause this relentless fatigue? When cancer cells grow, they compete with normal cells for nutrients. These cancer cells can produce substances that alter the way your body makes energy, leading to an energy deficit. This results in a constant feeling of tiredness, known as cancer-related fatigue, CRF. In addition, the body's immune response to cancer can also contribute to fatigue. The immune system releases cytokines, which are chemicals that help fight cancer, but also cause inflammation. This inflammatory response can lead to a feeling of exhaustion. Did you know that about 80% of cancer patients experience severe fatigue at some point during their illness? This fatigue is not relieved by sleep or rest, making daily activities feel overwhelming. Of course, it's also possible that you're just tired from the daily stresses of life. Work, family, and other responsibilities can wear anyone out. But if you find that your fatigue is persistent and unexplainable, it's important to talk to your doctor. They can help determine if there's an underlying cause that needs attention. Your health is worth checking out. Sign 6. Changes in bowel and bladder habits. We all have our routines, and going to the bathroom is no exception. But what if you notice something out of the ordinary when you use the restroom? Maybe it's a change in how often you go, the color or smell of your stool or urine, or even seeing blood. These changes might seem minor, but they can be significant indicators of something more serious. Significant or lasting changes in your bowel and bladder habits could signal something serious like cancer. For example, colorectal cancer often presents itself through changes in bowel habits, such as diarrhea, constipation, or a change in the consistency of your stool. Bladder cancer might make you notice blood in your urine or a need to urinate more frequently. Prostate cancer can also affect urination habits, causing difficulty starting urination or a weak urine stream. Did you know that colorectal cancer is the third most common cancer diagnosed in both men and women in the United States? Changes in bowel habits are one of the most common early signs. It's crucial to pay attention to your body and notice any significant changes. These changes can include persistent diarrhea or constipation, a change in the color of your stool, especially if it's dark or black, blood in your stool, or urine, unexplained urges to go to the bathroom, pain or discomfort in the abdominal area, difficulty urinating, or changes in the frequency of urination. While many of these symptoms can be caused by less serious conditions, if they persist, it's important to consult with your doctor. Early detection of cancers, such as colorectal, bladder, and prostate cancer, can significantly improve treatment outcomes. Don't ignore these signs. Your health is too important. Sign 7. Sores that don't heal. Imagine you have a sore on your lip or inside your mouth that just won't go away. At first, you might think it's just a minor irritation or a canker sore, but weeks go by, and it still hasn't healed. Persistent sores can be a warning sign of something more serious. Sores that don't heal could indicate skin cancer or oral cancer. For example, if you have a sore on your skin that doesn't seem to get better, it might be more than just a simple cut or scrape. Similarly, sores inside your mouth that linger can be an early sign of oral cancer. Did you know that skin cancer is the most common type of cancer in the United States? Basal cell carcinoma, squamous cell carcinoma, and melanoma often present as sores or lesions that don't heal. These sores might bleed, scab over, and then bleed again. It's not just the skin that can signal trouble. Inside your mouth, a sore might appear as a white or red patch that doesn't go away, or a lump that feels thickened. These are often signs of oral cancer. Regular dental checkups can help catch these issues early, as your dentist can perform screenings and notice any unusual changes. It's also important to note changes in other areas of your body. For example, sores on your genitals could be a sign of genital cancer. Persistent sores, wherever they occur, should not be ignored. If you notice any sore that doesn't heal within a few weeks, It's important to get it checked by a healthcare professional. Early detection and treatment are crucial in managing cancer effectively. Your health is too important to ignore these signs. Sign 8. Weird skin changes. Our skin is like a canvas, reflecting what's happening inside our bodies. Have you ever noticed a new mole? A spot that's changing color? Or a patch of skin that looks different? These changes can be more than just cosmetic concerns. They might be early signs of skin cancer. Skin cancer is the most common type of cancer in the United States. 1 in 5 Americans will develop skin cancer by the age of 70. It's crucial to keep an eye on your skin and recognize changes that could be warning signs. Here are some specific changes to look out for. New moles or growths. If you notice a new mole or growth that wasn't there before, it's important to monitor it. Changes in existing moles. Pay attention to changes in size, shape, or color of existing moles, as these could indicate melanoma. Sores that don't heal. Persistent sores that don't heal within a few weeks, especially if they bleed or ooze, should be checked by a doctor. Unusual patches. Look for red, scaly, or rough patches of skin that might indicate basal or squamous cell carcinoma. Itching or tenderness. Skin cancer can cause itching, tenderness, or pain in the affected area. Regular self-examinations and yearly skin checks by a dermatologist are essential, especially if you have risk factors like fair skin, a history of sunburns, or a family history of skin cancer. Early detection can make a significant difference in treatment outcomes. Remember, your skin can provide important clues about your overall health. Don't ignore changes. Your vigilance could save your life. Dealing with potential cancer symptoms can be incredibly stressful and overwhelming. It's normal to feel scared or uncertain about what these symptoms might mean. But remember, noticing these signs early and seeking medical advice can make a significant difference in your health outcomes. If you've noticed any of the symptoms we've discussed, it's important not to panic. These symptoms don't necessarily mean you have cancer, as they can be caused by a variety of other health issues. The key is to stay proactive and consult with your doctor to get a clear understanding of what's going on. Your healthcare provider is there to support you and guide you through any necessary tests or treatments. They can provide the information and reassurance you need to take the next steps with confidence. If you enjoyed today's video, then please share it with friends and family. Let's spread the word and we could potentially save a life.